Good afternoon and welcome to the Western Sydney Local Health District Annual Public Meeting. This is what we call our Western Sydney Health Forum for 2024. Our audience this afternoon is online and you're tuning in from wherever you may be in Western Sydney and beyond, so welcome. I'm Associate Professor Naren Gunja, Chief Medical Information Officer for Western Sydney, and I'm your host for today's forum. I'd like to begin by acknowledging the traditional owners of the lands on which we meet, wherever you may be. I'm at Westmead Hospital today, which is in the lands of the Barramudigal people of the Darug Nation, and I pay my respects to elders past, present and emerging. So thanks for joining us. This is an opportunity for our community to hear about the highlights of healthcare delivery in the district, the future of healthcare in your district, and to ask questions of us, the staff, clinicians, and the executive of Western Sydney Health. I'm going to be joined by senior executives, clinicians, and frontline staff who are going to share some of the insights into healthcare in our district. As an annual public meeting, this forum also serves as an opportunity for you to ask questions of us. And to facilitate this, we're going to be using slido.com. So you can use your phone app or go straight to a browser on your phone to slido.com. It's free, online and interactive to be able to easily ask us a question, be it one of our speakers, our senior executives, or panelists on today. The participant code on slido.com is WSHF24. Now we're going to endeavour to answer your questions during this 1 hour forum. If time permits, if you don't get a chance to ask your question or you think about it later, you can always send us feedback by completing the inquiry form on our website, which is www.wslhd.health.nsw.gov.au. I'm going to open today's Western Sydney Health Forum. I'd like to introduce Loretta Demento, Board Chair, who will share the year in review. Loretta became Board Chair in August last year, having served as Deputy Chair prior to that. As a Chartered Accountant and former Audit Partner at Ernst & Young, Loretta serves as a board member to a number of government and not-for-profit organisations. Welcome, Loretta.
Thanks very much, Naren, and good afternoon to you all. Such a pleasure to be here today to share some of the insights and the outstanding work of Western Sydney Local Health District for 2023-24. And I think it's very important to take the time to reflect on our achievements each year. Much has been achieved. Our district is responsible for delivering $2.5 billion in public health care. And the work is carried out across 5 hospitals, 7 community health centres, and an integrated network of services, all supporting more than 1 million residents across 120 suburbs. Our district is one of the fastest growing regions in Australia. Our community is dynamic as it is diverse. We are proud to have one of the largest urban populations of Aboriginal people in the country, and that enriches the cultural identity of our region. Nearly half of our residents are born overseas and speak languages other than English at home. And in recognising this diversity, we are committed to providing inclusive and culturally sensitive healthcare that meets the unique needs of all of our community. Whether it's addressing language barriers or supporting individuals with complex health needs, we aim to create a safe and comfortable environment for healthcare for everyone. There do remain some significant challenges in delivering healthcare services to a growing community and in responding to increased demands for services. These areas include mental health, diabetes, childhood, obesity and ageing, just to name a few. With young people making up 16% of our population and higher homelessness rates than the state average, and an ageing community, planning for the future is critical, and that is building sustainable healthcare services and preventing focusing on preventive programs. Over the past 12 months, our district has achieved some remarkable milestones. Our workforce, which is a team of 14,000, has been at the heart of these successes, driving innovation, collaboration and improved patient outcomes every day. To share some of the highlights from across the district, we are releasing the Western Sydney Local Health District Year in Review for 2023-24. You'll be able to view and download a copy of it from our website, and there's some things that you'll read about that I'll touch on here as well. At Blacktown Hospital, we've seen two exciting firsts. The introduction of capsule endoscopy that allows us to examine the small bowel with a tiny ingestible camera, and the first bronchoscopy procedure, a crucial diagnostic tool for conditions like cancer and tuberculosis. They're just two examples of the advancements that recognise Blacktown Hospital's growing capacity to manage more complex procedures, ensuring we continue to meet the community's needs. And to further support this work, we've received a $120 million funding boost, and that's going to Blacktown and Mount Druitt hospitals to add 60 new beds and help modernise our facilities. At Auburn Hospital, we've achieved 100% elective surgery access rates, reducing patient wait times, improving surgery schedules, and even cutting fasting times for patients. A commitment to safety and quality has seen many improvements, including 0 hospital-acquired bloodstream infections over a 6-month period, and that equates to avoidance of 31 hospital days. Westmead Hospital celebrated 45 years of excellence, and we marked the milestone in a few ways. We invited our community to celebrate and experience a virtual reality tour of the hospital's history. We had an anniversary gala event to mark over 4 decades of very close collaboration with the University of Sydney, along with some other celebrations. We were joined by the Minister for Health, Ryan Park, to officially open Australia's first multi-purpose cystic fibrosis specialist service ward. It's a $65 million facility, and it's providing essential care to Australians living with this condition. In another groundbreaking achievement, Westmead performed the country's first laser-assisted epilepsy treatment. Led by pioneering neurosurgeon Dr. Mark Dexter, Westmead, this minimal invasive procedure offers a safer alternative to open brain surgery right here in Westmead. Beyond our hospital walls, our integrated and community health services have continued delivering exceptional care to those who need it most. For example, our multicultural health teams provided over 320 health education sessions, reaching something like 5,700 people. These sessions covered topics like cancer prevention, maternal care, and very importantly, so they remain accessible, they were all delivered in language. Our Centre for Population Health launched 2 pivotal plans this year, the Health Promotion Framework and Strategy and the e-cigarette action plan. Both of these strategies take us through to 2025, and they're just some of the initiatives that demonstrate our commitment to addressing health inequities and improving community wellbeing now and into the future. Our oral health services in another busy year delivered vital dental care checkups to more than 8,000 school children through our mobile dental services program. And when it comes to finances, I can report that the district has managed above target activity levels, successfully reducing surgical wait lists and seamlessly integrating St Joseph's Hospital at Auburn into our district services delivery footprint. 65% of the total $2.5 billion expenditure is made up of our investment in employees and their related costs. The district's own source revenue increased to $246 million, which in turn contributed to health service funding. And let me wrap up by saying that reflecting on 2023-24 fills us all with immense pride. The work we do would not be possible without the dedication of all of our staff, of all of our communities, consumers, our volunteers, and the support of our very committed partners. all who contribute to making a difference in the lives of our communities, our patients and their families every day. We have many achievements to celebrate, and we remain very focused on building a healthier future and delivering world-class care for Western Sydney. And you'll hear more about that through today's forum. Thanks.
Thank you, Loretta, and what an impressive year it was. As you've heard, our district is a health service delivering care to thousands of people in Western Sydney every day. The local population is growing, and with it their needs are changing. Planning and managing healthcare services to meet these needs can be a challenging for the district, with a need to continually enhance and improve. As Chief Executive of the district, Graham Law's years of healthcare leadership and strong focus on system performance provides a platform to deliver high-quality care for each and every member of our community. Now I'd like to welcome Graham to address the forum on the district's highlights.
Thanks, Naren, and I love the opportunity to get up and talk to the community, both our staff and the community that we provide services to. It's such a critical component of who we are and what we do. Can I commence by acknowledging the traditional custodians of the lands, and I know that we each do it as we stand it, but it's really important that we do that and we actually make sure that we address culture. Nothing is more important in culture in our organisation, and you know, at the top of that list is the culture of the First Nations communities and how we recognise that. So can I recognise the traditional custodians, pay my respects to elders past, present and emerging, and anyone who may be watching or with us in the room today. Can I also thank Loretta and the board. It's really important for us that we get a really strong relationship with the board. You know, we have a huge organisation to run, and we do a lot of interconnection with the community, but a lot of that skill set that we have is also, you know, enhanced by our partnership with our board members, and the time that we spend with the board and the expertise that they bring is really valuable. So I really want to thank the board for their support and assistance through that process. And I equally want to thank the support of government and the ministry around how they help not just Western Sydney as a district, but the communities of Western Sydney. There's a huge investment by this government and by this ministry, and in particular a really strong focus by our Secretary Susan Pearson, the support that we get for that, and it's really valuable to us, and it makes a lot more rewarding the experiences when we know that there's a really strong relationship with head office and how we do that. And it's important for me to know that the ministry takes it, the relationship with the communities of Western Sydney just as importantly as I do. So I really want to acknowledge that and thank them. And I also want to thank my executive team. It's been a pretty busy year. It's been a bit turbulent. We've had lots of movements around, but every time that we ask something of the executive, or every time the ministry asks something of us, we always step up and provide what is needed, and we work together as a team. And my view of leading organisations like this is that you are nothing without your team, because no one I know is good enough to do it on their own, and it really is about how we work together. Having said that, what we've actually been able to achieve in the last 12 months has been nothing short of amazing. When I look at where we came from 6 years ago when I started to where we are now, it's a phenomenal journey. The last 12 months just here at Westmead alone, working with our partners on the precinct around what we can deliver, how we're looking forward to the future and how we're planning for what's next is amazing. As you know, a couple of years ago we opened a new clinical services building. Right now I'm watching the paediatrics building being built next door with the Children's Health Network. We've started work on the new mental health facility on the back, another $540 million investment by government around how to continue to grow and provide state-of-the-art care to our mental health patients. And that's really, really important, because the medical care and the clinical care for our mental health patients is just as important as the mental health care. So how do we bring those services together and align them is a real strong part of the planning moving forwards. And no more important this year, because we started the celebrations at the beginning of the year of the 175 years of Cumberland Hospital, Australia's oldest mental health facility, continuously run, and the work that goes on there is amazing. The people that provide it are phenomenal, and the care that the community receives is just outstanding. It just impresses me every day to see what we can do and how far everyone will go to make sure the people who are here under our care get the best possible outcomes that we can. The other big development that we've got going on at the moment is Rouse Hill, and no doubt it's been in the media a lot around the progress in that space. We are well and truly down the design pathway. We've got the shells of the building all worked out of where we're going, and we're just finalising the models of care and what we need to run it. It's a really, really exciting opportunity around how do you run hospitals differently. It's been decades since we've had a greenfield hospital that we can design and right from the start and think, how do we innovate? How do we build a hospital of the future? How do we embrace what the patient experience and journey is as part of the design of the building and think very, very differently? And that's been embraced really strongly by Julia and the team out there at Rouse Hill around how we deliver that. So I'm really excited to see what that looks like in a couple of years' time when the doors open, because I think the communities of the Hills District really deserve something special, and what is going to get built there will be the benchmark for other hospitals, and everyone else will be looking to see how it's been done to try and replicate that. Blacktown is a fantastic site for us, and it's really worth just mentioning around how strongly it has grown over the last 12 months, from a district facility that was a large hospital about 5 or 6 years ago, now into a tertiary referral service, now an A1 classification hospital. It's probably one of the fastest growing sites in the state, with 10% increase in presentations every year, but with a huge amount of work being done by the teams out there. The leadership team, the executive, the senior clinicians, the nurses and allied health professionals on the floor coming together to say, how do we continually improve? How do we do it better? What models can we implement? And we really see that play out now in the significant improvement in the performance at Blacktown, and some of those metrics that we like to talk about. The amount of time that it takes us to help offload ambulances and get people into care and see a doctor quickly. All of those things are improving significantly and have been for the last 12 months. So it's really great to see some of the fruits from all that hard work that's occurring out there. I guess at a system level, performance continues to improve. We know we've got challenges in different areas, and we're working hard with the teams on that. And we know those areas that we need to look at and need to work on. Part of it is bouncing back out of a COVID timeframe where the profile of our clientele and our community has changed, from the profile of what their health needs has changed into an environment where our health system functions a bit differently. So I'm really keen to see how that grows, and I'm really pleased with the efforts that are going in. I'd just like to finish up by saying to our staff, to every single person that's out there, we are here for the patients, and they come first, and they are the centre of every decision we make. However, we don't do it without our staff. We have the most amazing group of staff that are here, from nurses to doctors to corporate to allied health to even us administrators. The commitment from everyone in this system is phenomenal. I'm enormously proud to be able to stand up in front of Western Sydney and say this is a great team, and I love to come to work every day because I know that everyone who comes here does their utmost best every single day to help the people that are in front of them and to make sure that they look after their co-workers in the same process. So thank you all. It's been a brilliant year. It's been great to spend another 12 months with you, and look forward to what we do in the next 12 months. Thanks very much.
Excellent. Thank you, Graham. We now progress to the first of our two panels. The first one will be about the rapidly expanding world of virtual care, virtual healthcare. And joining me today to share their insights into the programs supporting virtual patient care are three of the frontline staff managing and working in this space. So welcome to Nereus Marinan, Asha Al-Hasid, and Daniel Sid. Thanks for joining me. So first, I'm going to start off with you, Nereus. You are the program manager for InTouch. You're responsible for providing a range of services that deliver healthcare virtually through phone and video modalities. Virtual healthcare is still fairly new, particularly during COVID, but it's rapidly evolving, and you've been involved in the InTouch program since April last year. Can you tell us a little bit more about InTouch and what type of care is typically delivered and to which kinds of groups in the community?
Thanks, Noreen. So InTouch is the umbrella term, which has a number of care streams under it, a number of models of care. There are some elements of care that are common throughout those streams, and I'll talk about them now. So some of the services that we provide is care navigation, which means simply to connect you to a service, care coordination, which means to support your healthcare journey, self-management support, which is to help you better understand your healthcare needs, and post-discharge follow-up. So if you were ever discharged from any of our 4 hospitals in the district, you'll get a call from InTouch. We typically work with patients that are at risk of hospitalisation. We work with patients who have complex care needs. Most recently, InTouch has been providing an urgent care service to residential aged care facilities, and we've been connecting patients who have non-life-threatening issues to most appropriate care other than the ED.
Okay. Asha? As the virtual care manager, you play a role in ensuring our technology enables us to deliver this virtual care. Can I ask you about how you've seen virtual care evolve over the last decade in our district, particularly through COVID and to where we are now? And how does technology support and improve the delivery of care?
Thanks, Lorraine. I think that both patients and clinicians recognize the benefits of virtual care. This includes reduced travel time and cost. It also includes access to services which are not necessarily available if you live in remote areas, and also the self-management of health conditions. But at the same time, patients and clinicians want to make sure that technology is safe and reliable. To support this approach, we've rolled out and implemented a few technological options in the past few years. One of them is a video call between patient and clinician. And the great benefit of it is that patients can attend the call at the comfort from home and not necessarily having to attend in person. The other benefit that it provides or it offers is obviously the fact that some of these patients, they need to provide, they have family and work commitments, and again, it makes it much, much easier. The other technology that we've recently launched is a remote patient monitoring, a diabetes tracking application. This application is targeted for patients with diabetes type 2 and also gestational diabetes. What they can do is track their glucose level using their meter reading at home. The data goes to the clinician website. All of that is in real time and saves the time to attend always in person and wait until your next appointment to discuss your health conditions.
Thank you.
Thanks.
We will have some follow-ups for you. I'm going to go over to Daniel now. So Daniel is a chronic and complex senior physiotherapist. He's been a passionate champion of virtual care to our community physiotherapy services. Daniel, being on the front line, you've seen how face-to-face interaction is and how that's evolved to virtual patient care. Tell us about how technology has changed the perception of virtual care.
Yes, I think the technology actually closely relates to the virtual care expectations. Like if the technology is really bad, then the perception will be translated to the virtual care as well. I think that's what we saw in initial stages when we first started implementing virtual care in our services. It was really hard, it was really clunky. But as the technology has developed and grown, that's actually changed as well. They're now become easy, it's more time efficient for them. They can have time for other things. They don't have to hassle other people to get things done because they've got this great technology that they can use.
Can you share some feedback from patients who've used virtual care in your service? What's been the general perception?
Yeah, I think generally they've just said that it's really easy to use. It's much easier than they anticipated. Less buttons to press. I think the other thing that they really appreciate is just being able to get everyone that they need in contact with. Sometimes that's really hard to do face-to-face when you want the physio, the OT, the nurses, and then maybe even the doctor all in the same space. But virtually, that's a lot easier to do for them. And I've actually had one person say, I feel a lot younger now. I can use video functions, which, you know, if you asked me 2-3 years ago, I'll never be able to do.
Right, excellent. Nereus, I'm curious about how a clinic would start using virtual care. So if you're a service or a clinic that wants to consider using virtual care or implementing it in their service, what should they think about? How do they go about that?
Yeah, thanks, Darren. I think the first thing people will probably just straightly go to is the technology. I think it's bigger than that for when you're starting a clinic around virtual care. I think you need to consider the environment that you're doing it in. At InTouch, we're at an older facility in the district, but we were successful enough to get some refurbishment funding to refurb that. Some of the things that we focused on other than technology was to support the noise dampening in the room, but also to look at the furniture and fixtures and choose most appropriate furniture to support clinicians, but also to make sure that clinicians were comfortable and also working in a team environment. So that's something that people need to consider when they're opening or at least implementing a virtual care clinic, is that they look at the flows of their clinic, look at the actual workflows of the clinicians, and making sure that they build the environment that supports that.
Thank you. Asha, one more for you. What does the future look like for virtual care in your mind? How is it going to progress to being less reliant on hospital-based services?
I think that one thing we're going to do next year is consolidate the multiple video call systems or platforms that we have. That's going to help clinicians and patients to be familiar with one or two systems rather than if you want Health Direct is the statewide application that we're all going to move to. We want to also expand on remote patient monitoring beyond just diabetes at this stage. We believe that it offers great benefits and that it's got great potential. We obviously want to see more more services, clinical services, adopting virtual care, obviously through technology and our support.
Great. Thank you. Thank you, Nereus, Asher, and Daniel, for your time today. That's excellent. Okay, remember you can also send your questions through slido.com using the participant code WSHF24. Our second panel today is about careers in healthcare. As an employer of over 14,000 staff, including clinicians, administrators, admin staff, cleaners and trade professionals, there is no doubt a career in healthcare affords multitude of possibilities. Joining me for this discussion are three clinicians at Western Sydney, a nurse, a doctor and an allied health professional, and we're going to get to hear a little bit about how they built their careers in healthcare at Western Sydney. So first up, we've got Anna Lam. Thanks, Anna. Who started off as a new graduate nurse here. I won't say how long ago, Anna. And went on to become a nurse educator as well as a NUM, a nurse unit manager. She now finds herself putting all of these years of experience into providing advice both to the executive but also to other clinicians. Our health district employs over 7,000 nurses and midwives. So Anna, what is it that you love about your role in supporting nurses and midwives?
So Naren, so I'm really proud that I'm involved in creating opportunities through transitional programs, forums and symposiums to support our nurses and midwives, so they're able to provide exceptional care to our most vulnerable members of the community. With the Nursing and Midwifery Executive Team, we're dedicated to empowering nurses and midwives at all stages of their career, so that they can progress and have opportunities to then be able to become skilled clinicians, and then we have a highly skilled workforce that is adaptable into the future.
Yep. So what does a career in nursing and midwifery look like at Western Sydney, and where can it take you?
So like you said, I started here as a new graduate nurse 24 years ago. So I can say from personal experience that the opportunities at Western Sydney are endless. I've been through as an educator, I've been a clinical nurse consultant, as a manager, and now sitting in this position, I'm able to then offer the next generation of nurses and midwives any career that they want. So we've got pathways for nurses and midwives who'd like to go into education, so become clinical nurse educators or nurse educators, if they want to become advanced clinicians and become nurse practitioners, or even leadership programs for them to become NUMs, nursing unit managers, or even a director of nursing one day.
Wow. The district offers a career pathway for Aboriginal people in nursing and midwifery. What does that pathway entail?
So our Executive Director of Nursing and Midwifery works closely with our Director of Aboriginal Health to offer opportunities for our Aboriginal nurses and midwives. So we start off with, for our new graduate nurses and midwives and cadets, we offer them a culturally appropriate mentor. So it's someone that can help them transition in their first year from study into practice, and it's an opportunity for them to have a safe space to talk to someone who's been through the experience before. Our Executive Nursing and Midwifery Director of Nursing and Midwifery also hosts a biannual Aboriginal Nursing and Midwives Forum. It's a space where we give them valuable updates on career and education opportunities, any scholarship that's available. And then we also hold a networking and some cultural activities for them as well. We also have identified and targeted positions across all nursing and midwifery specialties. So it's a pipeline for us to have some skilled representation across areas of our healthcare.
Excellent, thank you. Now moving on to Brendan for an allied health perspective. Thank you. Brendan has more than 10 years as an allied health professional in radiation therapy. He works here at the Westmead Crown Princess Mary Cancer Centre and has pursued various roles, including being an educator, project manager, and has also completed an MBA. So Brendan, what's driven you to seek these opportunities in health? And what have you learnt from all your experiences that you can impart?
Yeah, so I think initially curiosity was the main thing. So when you start in a large department such as Westmead, you witness all the different possibilities of roles that are out there. So you've got the clinical roles, which you hear about at university, but it's all those non-clinical, as you said, the educator, the project management roles that exist within health. And so then once I'd seen all that and I was able to move to a smaller centre which was developing, I knew what to look for. And so I was able to take opportunities and ask for opportunities before they'd actually even arisen, and put my hand up and try things. And that's where my passion for like project management and change management, quality improvement really came to the fore. So when I returned to Western Sydney then, having taken all that experience, it sort of put me at the forefront then to seek bigger opportunities which exist everywhere in a department, like in an organisation this large. And so I suppose the key learning is to say yes and to put and just take that risk and to say yes. And the same thing with the MBA. The reason I did that is because when I started my career, I think it was North Shore, a really young person was appointed as the director of radiation therapy there. And from the outside, it appeared that his defining attribute was that he had an MBA that no one else did. And so that was when I was like, that's what I've got to do. If I want to be in that position, I have to give myself the opportunity. And so I said yes to myself in that instance. And I've just sort of taken that attitude throughout.
That's great. You're also completing the district leadership program. It's called the FLASH program, Fostering Leadership Across Systems in Health. As an allied health professional, what insights can you share about this program and the opportunities it affords?
So I suppose I've done quite a few of the leadership programs here, but it's particularly FLASH. It really taught me how similar all the different 30-odd allied health professions that we have in this district are with the problems and everything. And so rather than when something arises, we try and reinvent the wheel within our own silos, we can look to our peers who operate within the same hospital structures, who have the same patient demographics, to learn from their experience to solve our problems. And this sort of is breaking that sort of traditional health, like FLASH is looking to break that traditional health mentality where in the old days the best clinicians were appointed to management and they didn't necessarily have those the right leadership attributes at the beginning. And so FLASH is trying to provide the next generation of leaders, particularly in allied health, with those skills before they get there. So the ability to ask, like outside of your own silo, what did you do differently? And so we can apply that within our own discipline. And the opportunities within FLASH are tremendous. So I recently when I finished the course, we had the opportunity to do a shadowing day with the chief executive. And so in that, I learnt the nuances of leadership that they can't teach in a course. And so that's the sort of leadership teaching that this sort of course offers.
Yeah, excellent, thank you. Sarah? So Dr. Sarah Ghali is a senior psychiatrist and medical director of the Western Sydney Mental Health Service. Sarah, you've had a number of roles in the district since joining as an intern, I think. I think I do remember you from an internship, but also including as Director of Training for Psychiatry Registrars. So what do you see as the driving force behind your career choice in health, and how did you navigate your way to where you are now?
Yeah, I guess the short answer was I did not actually see myself initially in a career. From primary school, I always thought I was be a lawyer. We were lucky that the school I went to engaged a career counsellor and matched up my sort of psychological profile to more a career in health. I then looked at the courses that were available, and the University of Newcastle was the one that appealed to me most. They had this problem-based learning course which sounded really interesting, and it's really set the scene now for medical education all across the nation. When it came to then deciding where to do my pre-vocational training, Western Sydney actually leapt out, particularly Westmead, as a centre where it was a one-stop shop, where I was still undecided, but there was this really big network for psychiatry training. There was the opportunities to explore neurology. There were just all these subspecialties that I thought I could dive into. So that was the reason I picked that district as in my pre-vocational training. And along the way, have had the opportunity to be mentored, particularly someone who stands out was Emeritus Professor Ryan, who, like what Brendan mentioned, every time he suggested I try something, for example, introduced me to a trainee representative role in a formal role in the college, encouraged me to become a clinical academic, and we co-authored a chapter in a handbook in psychiatry, which was launched just a fortnight ago. So just having those opportunities, and as Brendan said, saying yes, has led to my pathway till now.
And what advice would you give to a budding clinician who might want to choose a career specifically in mental health? Yeah,
so I think when I first started this, I think psychiatry was always the poor cousin of our physician and surgical colleagues. But I think it's now become a big public health agenda, and I think this is an opportunity to be part of something that's really important for our community, particularly looking and addressing stigma, which still exists greatly around mental illness, being part of bridging that gap between the mind and body. And what excites me and I think keeps me leveraged here in Western Sydney is the future of mental health services here. I think the integrated mental health complex is not just symbolic, but it's actually, this is where it's going to happen, where people's physical and mental health needs are being met in one place, in mainstream services, and really it's no longer symbolic, but it's actually, it's eventuated that we're actually looking at a person in their completeness. So I think it is an exciting field. I'd have to say the numbers of opportunities, both in the public, private, NGO sector, they're endless. So it is an exciting field. It is now considered important. Yeah.
Yeah. A common theme that all three of you brought up is one of mentorship. So Anna, I might ask you, what mentorship opportunities are there available for nurses and midwives in order to retain and support the talent that is here in Western Sydney?
So I suppose we really believe in growing our own. So it's, the concept of working where you live. So a lot of our nurses and midwives work around Western Sydney, and we start right from, when they start their new graduate program. We've got a really robust framework that provides them with mentorship, preceptorship and clinical supervision as well. But also all the other things that I mentioned, that there is opportunities in any area for any nurse or midwife to go into, whether it's education, management, or even academia, becoming a researcher, where, we can foster the collaboration with our tertiary partners. And so I think having all those opportunities and programs available for our nurses and midwives, we keep them here, and every year with our new graduate program we always have a retention rate of over 90%, so that just it proves that everything that we've got here makes them want to stay, and then it increases our retention rate.
Great. I'd really like to thank all three of you for joining us here today and sharing your career pathways. Let's hope it inspires somebody out there looking for a future in or career in healthcare in the Western Sydney community. So now it's over to you to ask us questions. I'm going to ask our Chief Executive Graham Loy and Board Chair Loretta Demento to join us over in the chairs once again. And please go to Slido and enter the participant code WSHF24 to type in your questions. Thanks, Loretta and Graham. A couple of questions that have come through. Loretta, can I ask, or can we ask, what is the board looking forward to in the future, and particularly over the next year?
I do have this on. All right. You probably only need one more. We're really looking forward to next year. We've got a few things on our agenda. Some of them are a continuation of business, and some of them are about some new things. So in terms of the innovation agenda, we have so much that's coming together. You've heard a little bit about virtual health, you've heard about how we're embracing new technologies, you've heard about Rouse Hill and a new development there. So thinking about how innovation is in our DNA and the sorts of things that we do in Western Sydney, I think we're really looking forward to how we can capitalise on all the opportunities that brings for us across healthcare, because every time we're sitting in meetings with the executive team, we see that they're motivated by access and equity, and making sure that we use all of the tools at our disposal are important to how we continue to provide those services for Western Sydney. So we have a strong innovation agenda. It's motivated by how we improve the services ultimately for all our population here in Western Sydney. and it's underpinned by some extraordinary work. We can't even scratch the surface in an hour of all the things we do, and we haven't even touched on some of the work we do in research that underpins all of what we do. So our agenda is very full for next year. We're looking forward to it, and a lot more in terms of future planning.
Thank you. Graham, another question coming through. Blacktown ED, the waiting room there has been in the media a lot recently. Why do you think that is, and can you elaborate on some of the media scrutiny there?
Yeah, look, I mean, Blacktown Emergency Department does get a bit of airtime. It's a part of the community that, it's an area that the community is very reliant on, and so it gets a lot of activity, and it's growing very quickly. We have a lot of people who present and attend to come to the emergency department for care, and that's a good thing. That's what we're there for. I mean, the debate around the ED and particularly the waiting room is a really interesting one, and I can understand from a patient's perspective around when they spend too long in a waiting room that's not an ideal environment to be in, and they really want us to do everything we can to change that. And certainly there's a lot of work going on in that space, particularly around how we manage behind the doors rather than the waiting room. Because the debate around the waiting room is really interesting. There are certain commentators that might say the waiting room's too small and we need them to be bigger. The challenge in that space is that the waiting rooms are the area where the people who are new come to see us. So we might not know who they are, we might not know what their conditions are because they've just walked through the door. And so the suggestion that we make that space bigger so we fit more people in who we're not really sure what's going on with yet is actually not the right way to go about it. The discussion around what we should be doing in our EDs is what we do, and the conversations we have is around what we can do inside the emergency department so people come in quicker, so they don't sit and spend time in that waiting room, and then what do the models of care look like behind the scenes to make that happen. So we've tried a new model of care in Blacktown called iGEM, which is really targeting the frail elderly and how do we get them access to care more quickly, in a better environment that's more comfortable, and how do we get people home much quicker than what historically we've done. That's proven to be really successful, and I think about 95% of the people who come into that space now go home again from that space in a much, much quicker time. So they might stay 7 or 8 hours in the iGEM area rather than 3 or 4 days in hospital. So massive improvement in that space, and that's where the conversation needs to be, what happens behind the door, because I think the conversation around how do you make the waiting room bigger is a bit like having a conversation around how do you make a parking station bigger. You want people at the event, not outside waiting for the parking station to be opened up.
Yeah. Thank you. Well, that's all we have time for today. And that's a wrap. I want to thank all of you for joining the Western Sydney Health Forum. I'd like to thank the Board Chair and CEO for their time, as well as our panellists for their contributions and their stories. On behalf of the executive team and the Board of Western Sydney Local Health District, I wish you all a happy Christmas and safe holidays and a peaceful 2025. Thank you very much.